So today we'll discuss about bacteriology. So some of the clinical hints or the clues to diagnose the specific conditions. Okay. So first it is an atypical pneumonia. If the history is like that, okay, if there is atypical pneumonia or walking pneumonia, and then the signs will be more than the symptoms. Okay, so than the symptoms of the patient, the signs will be more. Like in X-rays, you can be able to see interstitial inflammations, and then so bronchial markings will be very prominent. Okay, so the signs will be more than the symptoms. If the question is like atypical pneumonia or walking pneumonia, you can close your eyes and you can mark it as mycoplasma pneumoniae. Okay, there is no other organism which is presenting as a term used like walking pneumonia. Okay, but for atypical pneumonia there are many other organisms like chlamydia and all, but the signs will be more than the symptoms. Is it clear? Okay. Second, history will be like a painless papule which will be turning into an ulcer or vesicle, and there will be bubo, and then there will be an ischemia. It is nothing but there will be an edema. Okay, so the edema in the vulval part or in the scrotum. Okay, so if there is a symptoms, so painless papule, ulcer and bubo, then it is probably it is a lymphogranuloma venereum, and it is caused by Chlamydia trachomatis serovar L1, L2 and the L3. Okay, so coming for the next, it is if the symptoms like mucopurulent discharge from the eyes, and then there will be acute follicular conjunctivitis, which is usually after the swimming. Okay, especially in an adult. So if there is a mucopurulent discharge from the eyes, and then there is T of any swelling, it is the organism is again Chlamydia trachomatis serovar D2K. So again you want to know here, in mucopurulent discharge, if you want to see for incubation period, okay, if it is about 6 to 21 days, it is in chlamydia. But if there is purulent discharge and the incubation period, that is in the symptoms, so the onset of the symptoms is about 48 hours, then it is in gonococcus. If it is a long standing, that is it is almost 3 weeks, it is in chlamydia, and if it is only 2 days, it is in gonococcus. So next, history, it is like mucopurulent discharge, the patient, and then followed by dysuria and urethral irritation. Okay, so again here mucopurulent discharge, right? So the gonococcus, it is usually purulent discharge, whereas non-gonococcal urethritis, it is a non-gonococcal urethritis, it usually produces a mucopurulent discharge. So the most common organism causing a non-gonococcal urethritis is Chlamydia trachomatis. And then for gonococcal urethritis, I told already, there will be a purulent discharge, whereas in Chlamydia trachomatis, it is a mucopurulent discharge. So most common cause of non-gonococcal urethritis, and most common cause of post-gonococcal urethritis, most common cause of epididymitis in males. So the answer will be Chlamydia trachomatis. Okay, so just for completion's sake, since we are dealing with chlamydia, so we want to highlight some of the important points of chlamydia. That's all. So next is history will be like Ishkar, regional lymphadenopathy and maculopapular rash. Okay, so this is a trial. So the symptoms is Ishkar, lymphadenopathy and the maculopapular rash. So diagnosis is scrub typhus, and some point you want to remember, like there is a zoonotic tetrad for the scrub typhus. So one, it is in trabeculid mite. Second, it is in mammals. It can be in mice or rat or the shrews. And then there will be history of any scrub vegetation or the forest. So the person went to the forest and he had a bite. After that he developed an Ishkar. and then there will be in lymphadenopathy, then it is in scrub typhus, and it is usually occurs in a rain season, okay, where the mite will be laying eggs, okay. So again, there is another point for lab diagnosis is in scrub typhus there will be an OX-K antibody will be increased. So next coming for, so this is a very easy, I think. 3R: rainfall, rat under 8 feet, and Weil's disease, that is in hepatorenal hemorrhagic syndrome. So the answer is obvious. Rainfall, rat, rice field, it is in leptospirosis. Okay. So there is a criteria also. Okay. So you want to remember another point, that is in Dingus ring. Okay, which will be seen in the Ellinghaus macula medium. That is a EMJH medium. You will be finding a Dingus ring. Okay. So one point you want to remember, and then there is a Fain's criteria. Okay, just remember the name itself. So Fain's criteria, it is for leptospirosis. Okay, so it is nothing but for the clinical, epidemiological, and the lab diagnosis of the leptospira. So next history it is in, so maculopapular lesion, which usually develops at the site of tick bite, and then is that is an erythema migrans. So obviously it is in Lyme's disease, and the osteoorgan is Bulia perductory. Okay, so Bulia, there is another lesion that is called as the bullae lesion also will be there. Okay, so next it is the history will be like inflamed pharyngeal mucosa, which is usually covered by grayish membrane resembling diphtheria. Okay, but it peels off easily. It is in Vincent angina, and organism it is in Borrelia vincenti. So next, so painless papule, which becomes ulcerated, hard and indurated, and there will be inguinal lymphadenopathy and condylomata later. So it is in syphilis. So this is a broad, okay. Just I want to know that it is a syphilis which is caused by Trichoderma pallidum. So now coming for stages of syphilis, you want to know some of the main key points. Okay, so first it is in primary syphilis. The patient will be having hot canker and inguinal lymphadenopathy. And coming for secondary syphilis, skin rashes and condylomata later. Coming for tertiary, it is a tapes dorsalis and aneurysm of ascending aorta and aortic regurgitation. And congenital syphilis, you know, the first it is an early manifestation is a nasal snuffles. So next, it is in Hutchinson teeth, mulberry molars, saddle nose, and Sabershi. Okay, so based upon these clinical features, you can make out whether it is in which stage of syphilis we are dealing with. It can be a primary, secondary, tertiary, or it can be in congenital. So these are some of the clinical or the hint words to make out the diagnosis easily. So next, so beefy red genital ulcer. So the term here is a beefy red. It's only used for Klebsiella granulomatous. Okay, so beefy red genital ulcer, pseudobubo, and there is a safety pin appearance. It is nothing but Klebsiella granulomatous. So next, so aerosol from the contaminated air conditioner and Pontiac fever. There is only one organism usually this hint will be given, that is aerosol from contaminated air conditioner is nothing but, yeah, it's a Legionella. So so the most common neurological abnormality in Legionellosis is confusion, or there will be a change in the mental status. Second, the most common extrapulmonary site involved in Legionellosis is heart. Okay. So this ends a part 1 of clinical words, or the clinical heads.